Joint and muscle pain are complaints that many of my patients suffer from on a daily basis. It's important that I find the real source of their symptoms so that I can make the proper diagnosis and prescribe the right treatment. X-rays, CAT scans, and MRIs have been for the longest time the tests I use to come up with the correct diagnosis. Recent advances in sonar and ultrasound technology have created a more functional and practical approach to evaluate joints, muscles, ligaments, and even nerves. This technology is called musculoskeletal ultrasound.
After I'd been typing for quite a while, I noticed a pain in my elbow. I was unable to open a jar, for instance, or a can, and I was unable to drive. This made me feel very frustrated.
As a personal trainer, I've always taken good care of my body. I knew, however, that I had some arthritis in my knee, but never expected to have such a hard time going up and down the stairs. Pain medication did the trick for a few days, but I started worrying when the pain would wake me up at night. How could I find out what was really going on with me?
Clinical evidence and research supports using ultrasound as the first diagnostic test for numerous musculoskeletal conditions. Diagnostic ultrasound offers a number of important advantages compared to X-ray, CT scan, and MRI in terms of safety and effectiveness. Musculoskeletal ultrasound simply uses sonic waves, and there is no exposure to radiation.
Musculoskeletal ultrasound is non-invasive and offers real-time imaging, allowing for examinations of structures at rest and in motion.
This ability to capture the movement of musculoskeletal components differentiates it from other imaging modalities and can permit more accurate diagnosis.
I was glad it was tendonitis in my elbow, and I knew after those years on the computer it would eventually catch up with me.
The doctor explained that the pain behind my knee was the result of a cyst filled with fluid. My doctor used the ultrasound machine to safely remove the fluid, and I have no more pain.
I use musculoskeletal ultrasound not only as a diagnostic tool, but also to provide safe and precise injections. This tool makes a huge difference in the effectiveness of my patients' care.
These are but a few of the cases where the astute physician, through their concern, learning, and experience, can guide the patient in the right direction toward a correct, timely diagnosis and start the right treatment plan. Ultrasound is an easy, reliable, and safe test.
The test was as easy as taking a picture, but best of all, everything was thoroughly explained to me about the test.
My doctor was able to come up with the real solution to my problem because of the imaging he had from my ultrasound test.
Our team of trained professionals, always in the closest of cooperation and communication with the patient and the ordering physician, is here to provide you with a pleasant and comfortable experience and to obtain the valuable information needed by your doctor. Proper testing assists in correct diagnosis that leads to appropriate treatment. Musculoskeletal ultrasound testing can be part of your health solution.